Are you or a loved one managing a chronic illness and feeling a little overwhelmed by it all? Do you sometimes wish that seeing your doctor was just a little bit easier? What if I told you there's a powerful tool, possibly already available to you through Medicare, that can make a world of difference? Hello everyone and welcome. It's truly wonderful to have you here today. Navigating life with a chronic condition like diabetes, heart disease, or arthritis comes with its own unique set of challenges. The constant appointments, the travel, the waiting rooms, it can all take a toll, not just on your body but on your spirit. We understand that journey, and we want to share something that can bring a little more ease and comfort into your life. Today, we're not just talking about Medicare. We're uncovering one of its most valuable and often overlooked benefits, telehealth services. Think of it as your doctor's visit, reimagined for your comfort and convenience. So what exactly is telehealth? It sounds technical, but the idea is beautifully simple. Telehealth allows you to connect with your doctor, specialist, or therapist using technology you probably already have, like a smartphone, a tablet, or a computer with a camera. It's a virtual house call. Instead of traveling to a clinic, you can have a secure, private video consultation right from your favorite armchair in your living room. Imagine this for a moment. It's a chilly morning, and you have a follow-up appointment to discuss your blood pressure readings. Normally, this would mean getting dressed, driving through traffic, finding parking, and sitting in a waiting room. With telehealth, you simply click a link at your scheduled time, and suddenly, your doctor's friendly face appears on your screen. You can talk just as you would in person, discuss your symptoms, review your medications, and get the professional advice you need, all without leaving the comfort and safety of your home. This isn't science fiction. This is a Medicare benefit that's changing the game for millions of seniors. Let me introduce you to someone who has experienced this firsthand. This is Mary. Mary has been managing COPD for over a decade. For her, a simple trip to the doctor's office could be exhausting and even risky, especially during flu season. Testimonial from Mary. Before I started using telehealth, some days it was just too much. I'd feel short of breath just thinking about the effort of getting to an appointment. There were times I almost cancelled, even when I knew I needed to go. When my doctor's office told me about video visits through Medicare, it was like a light turned on. Now, for my regular check-ins, I just sit on my couch with a cup of tea. I can talk to my pulmonologist face-to-face on my tablet. He can see how I'm doing, we can adjust my treatment plan, and I don't have to spend the rest of the day recovering from the trip. It's given me a sense of control and peace of mind I haven't had in years. It's truly been a lifeline. Mary's story is so powerful, and it's a story we hear more and more. The benefits of telehealth go far beyond just convenience. For those of us living with chronic conditions, consistency is key. Regular check-ins with your healthcare team are crucial for managing your health effectively, preventing complications and making timely adjustments to your treatment. Telehealth removes the biggest barriers to that consistency. Bad weather? Not a problem. Trouble finding a ride? No worries. Feeling too tired to go out? You can still get the care you need. This easy access means you're more likely to stay on top of your health, leading to better outcomes in the long run. It empowers you to be a more active participant in your own care. Now let's talk about how this actually works with Medicare. Medicare Part B covers a wide range of telehealth services. This includes not just routine visits with your primary care doctor, but also consultations with specialists like cardiologists, endocrinologists, and rheumatologists. It even covers mental health counseling, which is so important when dealing with the emotional weight of a chronic illness. You can use telehealth for things like managing your medications, follow-up appointments after a hospital stay, nutritional counseling, and so much more. The cost is typically the same as an in-person visit. You'll likely pay your usual 20% co-insurance for the doctor's service after you've met your Part B deductible. For many, this is a small price to pay for such incredible access and convenience. Dr. Evans, a geriatrician with over 20 years of experience, has seen the impact from the other side. Expert opinion from Dr. Evans. Telehealth has revolutionized how I care for my senior patients with chronic illnesses. I can see them more frequently for short check-ins, which allows us to catch potential problems before they become emergencies. I can see a patient in their home environment, which gives me valuable clues about their well-being. Are they moving around okay? Is their home set up safely? I recently had a video visit with a patient to review his new blood sugar monitor. He was able to show me the device, and I walked him through using it right then and there. This would have been much more difficult in a busy clinic. It allows for a more personalized, responsive, and continuous model of care that is perfectly suited for managing long-term conditions. It's a huge step forward for patient-centered medicine. As Dr. Evans mentioned, telehealth isn't just about talking. Your doctor can ask you to show them a swollen ankle, a skin rash, or how you're using a medical device. It's an interactive and effective way to receive care. Of course, it's not meant to replace all in-person visits. For physical exams, certain tests or emergency situations, you'll still need to go to the doctor's office. But for the many follow-ups and management visits that are part of living with a chronic illness, telehealth is an incredible and empowering alternative. So how do you get started? It's easier than you might think. The first step is to simply talk to your doctor's office. Ask them if they offer telehealth appointments and if your type of visit is suitable for a virtual format. Most clinics are now very familiar with this process and have dedicated staff to help you get set up. They can walk you through the technology, whether it's a specific app or a secure website link they email you. Don't be afraid to ask for a practice run. Many offices are happy to do a quick test call with you to make sure everything is working and that you feel comfortable before your actual appointment. Remember, this technology is here to serve you, not to intimidate you. Managing a chronic illness is a marathon, not a sprint. Having tools that make the journey smoother can make all the difference. Telehealth is more than just a convenience. It's a way to reclaim your time, conserve your energy, and stay more connected to the care team that supports you. It's a hidden perk of Medicare that puts you back in the driver's seat of your health journey, right from the comfort of your own home. We hope this has been helpful and has opened your eyes to a new possibility for your healthcare. Your well-being is what matters most, and you deserve to have access to the best and most convenient care available. Thank you so much for spending this time with us today. If you found this information valuable, please give this video a thumbs up and consider subscribing to our channel for more tips on navigating your health journey. We'd love to have you as part of our community. Take care and we'll see you next time.